Hi, this is Hao Luo, Assistant Professor from the University of Hong Kong. I'm presenting our CERVELLO study on behalf of Carmen, Kenneth, Wallis, and Ian. We're from UCL, University of Groningen, and also HKU. So CERVELLO stands for COVID-19 pandemic impacts on mental health related conditions via multi-database network. So the background is that the COVID-19 pandemic is having a profound effect on the mental health of population across the world. However, we suspect that specific sections of the populations are more vulnerable than the others. And these include people with existing mental health issues and neurodevelopmental disorder. So the objective of this study is to first characterize people with existing mental health conditions before the pandemic. And we want to examine changes in patterns of psychotropic drugs before and during the pandemic in this group of people. And then third is to investigate changes in relapse rate before and during the pandemic. And by relapse rate, we're interested in hospitalization, emergency department visit, and new prescriptions of psychotropic drugs. And due to the availability of vaccine, we added another objective, which is to examine the vaccination rates in people with and without mental health conditions. And here I'm only going to talk about study objective 1 and 2. So this is a cohort study including 10 mental health cohorts. These include people with an incident record of any existing conditions of anxiety disorder, depressive disorder, bipolar, non-affective psychosis, and all common mental health problems. And these 10 cohorts are not mutually exclusive because comorbid psychiatric conditions are very common in people with existing mental health conditions. And here, just a very brief example about how we define our cohort and taking anxiety disorders as example. We started with a very broad concept set and then made adjustment using cohort diagnostics. We want to include people who had an incident diagnosed between 2016 and 2019. And also, we want to exclude people who have more severe mental health condition, for example, bipolar disorder, non-affective psychosis, and also dementia. The outcomes of interest include 8 classes of psychotropic drugs, antipsychotics, hypnotics, sedatives, antidepressant. All these concept ID details are available in our protocol. The data analysis plan for objective 1 is very straightforward. We simply use the OHDSI cohort diagnostics tool to examine the baseline characteristics. And for objective 2, we want to look at changes in prescription prevalence by different age groups. And for each drug class, we will assess the age and country or database-specific user and prescription prevalence rates. And we also want to look at the trends over time by calendar year and also by months. And here I'm going to quickly present some of the provisional results from objective 1. A total of 84 million people with existing mental health conditions were identified from 11 databases. The total number of individuals identified range from 26,000 in Awesome in Korea, and then to 16 million Optum extended databases in the US. And here is the full list of all the participating databases. And here is a very rough presentation of the number of subjects in each cohort. And here is the proportion of people in each cohort. And we would like to note that the proportions are rough estimates, as one person may contribute to multiple cohorts. But just this is a very rough overview to show you that in each database, as expected, anxiety disorder and depressive disorder are the biggest cohort. And when the database is inpatient data or coming from primary care, dementia start to pick up and accounted for quite a substantial proportion. And here is the age distribution. It is seen that personality disorder was most prevalent in the younger age group, and except for personality disorder and dementia, the distribution for the other mental health cohorts seem to be comparable. And here is the prevalence of 25 comorbidities. As you can see that hypertensive disorder, hyperlipidemia, osteoarthritis, visual system disorder, and also acute respiratory disease were highly prevalent across all cohorts. UTI was most prevalent in people with non-affective disorder, and ADHD was more prevalent in people with personality disorder and bipolar disorder. And here is the prevalence of CVD. As you can see, other than dementia cohort, which is as expected, should have very high prevalence of cardiovascular disease, people with non-affective psychosis also have very high prevalence of CVD. And here is the medication use. The most prevalent is the psycholytics. Psycholytic use were consistently the highest in bipolar disorder and followed by non-affective psychosis and personality disorder. And then it is antidepressant, consistent. Of course, the highest use is in depressive disorder cohort, and then followed by personality disorder and bipolar. Another finding is the prevalence of antibacterials and anti-inflammatory products were also pretty high. Here is a quick summary of our progress. For project number 1, we have the results ready, and for number 2, we have the protocol ready, but still testing the package because we're looking at the by month prevalence, which needs to change, needs some more time to make sure our code is correct. And then for objective 3 and 4, we're also in the stage of developing our package. To conclude, this is an ongoing network study with preliminary results. And based on the work done so far, we find that comorbidities and polypharmacy are very common in the study populations. And updated results and conclusions will be available soon. And very welcome to visit our GitHub repository. I listed the result here. And so to conclude, please stay in tune, and we're very much looking forward for you to join our study. Thank you very much.